Hello everyone, welcome to this short video on conjunctivitis. So this is the whole table that you need to know to answer any USMLE step 1 or step 2 related question. So let's dig into it and let's see how they are different from each other. So starting with bacterial conjunctivitis, it is often unilateral, but it can also be bilateral, similar to the viral conjunctivitis. Mostly in the USMLE question, it's going to be unilateral. Make sure you look out for that details. For allergic conjunctivitis, it's going to be bilateral. Remember, this is a type 1 hypersensitivity reaction, so it can happen in the both of the eyes, right? In terms of discharge for bacteria, it's going to be yellow and green pus, right? So you will classically see a pus oozing out from the eyes and the redness of the eye. For the viral, it's going to be watery on mucoid, similar to allergic. It's going to be watery and mucoid, so there is no way you can distinguish viral or allergic conjunctivitis just based on the discharge, right? As I said, you have to look out for the details, if it is a unilateral or if it is a bilateral. Okay, if it is bilateral, it's going to be most likely allergic conjunctivitis. Now, other symptoms with the bacterial conjunctivitis, you might see some upper respiratory, you might see some ear infection, right? You might have some ear infection, but not necessarily. So make sure that you don't fall on that trap. For viral conjunctivitis, you will most likely see the upper respiratory tract infection, right? Any signs of upper respiratory, like a fever, headache, that type of stuff, and then patient developed the redness of the eye, that's most likely viral conjunctivitis. For allergic conjunctivitis, you'll most likely see the history of atopy, right? Rather, either patient has a history of asthma or allergic rhinitis, and there might be some other related symptoms such as sneezing, itching, a runny nose, right? Because remember, itching is because of it is a type 1 hypersensitivity reaction. So if you see itching and sneezing, that's most likely allergic conjunctivitis. In terms of etiology, as I said, allergic conjunctivitis is a type 1 hypersensitivity reaction. Viral, it's most likely going to be adenovirus. For step 1 exam, it's most like for step 1 and step 2 exam, it's most likely going to be adenovirus. For bacterial conjunctivitis, the etiology, it's probably Staph aureus, the most common cause in the adults. It could be strep pneumonia and H influenza. Remember, these two bacteria can cause conjunctivitis in children, so make sure you look out for that detail. In terms of treatment for bacterial, it's going to be broad spectrum antibiotic, and it's going to be topical, right? Because you don't want the systemic absorption. So bacterial conjunctivitis, it's topically treated for viral, and if it is a severe, then you might use oral broad spectrum antibiotic. For viral, it's going to be just conservative management. You can do a cold compresses, and for allergic, it's first thing you want to do is you want to avoid trigger, and you can use antihistamine drops, right? And if it is again severe, then you can also use oral antihistamine drops. So that's it for this video. Thank you so much.